Hello everyone, my name is Arya Priyanto. Welcome to Information Governance Awareness Training. Now we want to talk about the use of social media, especially in the healthcare sector. So before I start this training, I want to know how many of you in here that know about the social media, YouTube, Facebook, Instagram, Twitter, and etc. Yeah, most of you here know about it. And then it's really most of you here have the social media account. Oh, great. All of you have this one. Okay. The social media, it's really grown massively in the last decade. Social media, like the new thing in the people's life, they change the people's behavior. They change the way people share a content, share the feeling, share the emotion. And social media like really close because the growth of smartphone and mobile device like iPad, tablet, and etc. It's like support the growth of social media. So in this training, I'm going to talk about the overview of background analysis, what kind of related procedure and policy that is complement this training that you should know about that, and then what is the procedure details about the new guidelines policy of social media on the healthcare sector. So now, how many of you that know the number of social media in the world now? 1 million, 2 million, 100? In 2013, there are 1.7 billion users. 1.7 billion people who connect on the social media. And this number is growing massively today in 2020. 7 years after 2013, the number is grown 4 times. It's almost closely on the 4 billion users. So why we should care about the use of social media? What is the benefit of use social media on the healthcare sector? There are some benefits that is provided by social media for the healthcare sector. Social media can be used to share health experience. Patients can review the service of hospital. Doctor can share tips, the experience of treat people, and the patient also can share their experience when it's treated by hospital and doctor. As a marketing tool, social media also can be used to introduce your product, to grow your market, and to introduce your service in the market. As a media to promote and then to educate the patients, doctor can provide tips on the social media, and then the patient also can looking for some information from social media to improve their knowledge. And the organization also, it's the important thing, can build a professional image, can build the organization branding from social media. So, is there anything that some risk on the use of social media? Yep. There's some risk on the using of social media. First, social media can harm the privacy of patient. When your staff in the hospital or a doctor share a data of patient on the social media, maybe it's not really directly talk about them, but it's closely to them or share about them on the social media. It can harm their privacy. They will not be comfortable about it. And then can destroy professional image. When you provide some information and it's fake, it can destroy your professional image, your organization image. And then uncontrolled information. Once you click share on the social media, the information will go into the world, and everyone can access your content. Leak of information. Sometimes your employee maybe it's not a direct share your informations, organization information, but it's suddenly they clicked them and it's leak of information. Phishing attack, it can be done from social media because there are so many people on the social media is connected. Most of attacker will use the social media to attack each other. And then the fake information, hoax. Hoax really running massively on the social media. Not all information on social media is accurate and real. So people should concern about this one when you get information on social media. So what is the solution? We should have and we should build a policy. As information governance, it's need a policy and guideline to control, to regulate, to monitor the use of social media on the organization. That's why we are here. We want to learn about this policy. So there are some procedure and policy that is related with our new guidelines. First is National Safety and Quality Primary Health Care Standard, the National Safety and Quality Health Service Standard, Privacy Act and National Privacy Principle, of course, Computer Information Standard, and the Australian Public Service Commission Social Media Guidance. Yeah, you can count. So I will divide this training become a two. The use of social media as a professional use and as a personal use. So what you should avoid on the use of social media. Don't first share confidential information, your password, your organization data confidential, your privacy data. Don't share them on the social media. Don't share inappropriate content, bullying, harassing, hate speech, and etc. Don't share them on the social media. Because as a professional, you are a representative of your organization. When you share them on the social media, it will destroy your image, it will destroy your expertise, your organization. So don't share them. Like I said, consider your reputation before you share your content because it can destroy your organization's reputation. Consider risk security aspect because the use of social media, there are many people that want to know what information, what confidential information from you in the social media. So consider this point. Don't share risk security aspect. Don't provide a medical advice because as a person, as an expertise, the patient, family of patient want to know an advice from you. But when you provide this advice on the social media, it shows you are unprofessional. Suggest them to get an advice from a formal line. Give them a hotline on your hospital, on your organization, and give the advice not on social media. So what should do as a professional use? First, respect the communities. You should respect the community when you share a content. Understand them and give appropriate treatment for them. Talk only based on your expertise. Don't talk anything that it's out from your expertise because what you know is the accurate information that you're given on your social media. Accurate information. Use a real account. Don't use a fake account to provide information on the social media because it's like your responsibility. You share something, it's your role, so use the real account. Share only public information. Don't share private information about your organization, confidential data, only public information. Always read term and use on the social media platform. Don't obey them. Obey them. Don't avoid them. Don't ignore them when you do first sign up. Just read carefully and obey them. Privacy and confidentiality agreement. You should read about the privacy one. Don't share anything information about other people. Concerned about that, and it can result in a law issue, legal issue. So you should consider this point. You should ask a permission when you want to know, when you want to introduce the new information to the public. Ask the permission from your boss, from your manager. As a personal use, don't use organization property without a permission. You are not a representative of organization, so don't use a logo of your organization, the name of your organization, the trademark, etc. And then don't share a hoax information. You also, although you are not a representative of organization, but you mostly people, your friends know you work on this organization in the healthcare sector. What you share should be accurate, so don't share hoax information. Post inappropriate content, don't share a harassment thing, don't talk about hate speech, and etc. Don't build a relationship with your patient, because it's an unprofessional thing, and they will ask you an advice on the social media when you build a relationship with them on the social media. So don't do that. And don't use your social media on the working hours, because it will bother your focus on the work. And the important thing, when you use social media as a personal use, don't use your work email account, because when it's attacked by people, it will affect on the general system. And what you should do, first, respect a copyright and intellectual property. Don't share anything that maybe people take picture and you take it and share it on your Instagram without the permission of them. That will be a legal issue and harm the copyright and intellectual property. Don't do that. So respect the copyright. Use your identity, of course, is like your representative. Don't use a fake account. Respect of privacy. Don't share anything without the permission of other people. When you want to share them, ask them permission. Don't share your privacy too. And then you should consider the risk. It's like when you want to post this one, it will have a consequence, and you should calculate them before you share and make a content on the social media. Protect confidential information, because it will affect the security one, it will affect on the another issue. And you should disclaim, like when you want to post something on the personal use, you should mention like, I post this one as my name, not relate with my organization. That's important, disclaimer thing. Protect your organization data, of course. Respect and polite the audience, because your audience will hear you, will from any level, so you should consider that one. And then follow the regulation from the government, from the Computer Act, and the all regulation that is provided in the organization. Protect, the important thing is protect your reputation, your organization reputation. So, thank you for coming. I hope you already know. I already provide a brochure to you. You can learn that and ask to me after when you have a question about that. So, thank you for coming. See you on the next training. Bye.